As an offshoot of the 21st Century Cures Act, there are two rules from ONC and CMS respectively: the Information Blocking Rule and the Interoperability and Patient Access Rule will imply a sea change to the US healthcare ecosystem. The two requirements to satisfy these rules might prove to be tricky given the current state of the systems for provider and payer organizations. These are FHIR APIs for enabling data access and e-notifications. Patients need to be able to choose a third-party application to gain access to their data. What this means is that an app on their cell phone should be able to access the data sitting in the provider or payer systems. It goes without saying that security is imperative. This would require the implementation of Smart on FHIR capability for application authentication, leveraging OAuth 2.0 or OpenID or equivalent solutions. Along with authentication, authorization from the patient cannot be ignored. This would involve putting a framework such as consent to share or C2S in place to capture patient preferences for data sharing. Post this check, owing to the possibility of multiple versions of FHIR in the future and other technical considerations, an API gateway would be an implicit need. FHIR servers would be required to service the API calls. It needs to talk to FHIR and understand US CDI. While the current FHIR resource repository is present, it by no means covers all kinds of data in the ecosystem. That means custom extensions need to be created to cover all the data that organizations have, for sustainable interoperability, that is. Given that there might be possible allegations of information blocking in the future, organizations would need to keep an evidence trail of all the request processing. While this is not a regulatory need, it stands to make things easier in case of such an event. In line with the above, there are exceptions to the information blocking rule that need to be checked before servicing a request for electronic health information, EHI. So, there needs to be a log of why a particular request was denied or serviced in order to insulate organizations from legal repercussions. Capabilities such as cross-version support, FHIR profiles for different use cases, EMPI for ascertaining patient identity, etc., are going to make things all the more interesting. Most organizations have transaction processing systems and enterprise data warehouses, EDWs. Depending on the situation, one of the following three approaches might make sense. Direct binding with transaction systems. View on top of the transaction systems DBs can be bound to the FHIR resources to ensure reliable request processing. Publishing events of interest to a broker. It involves the overhead of publishing or subscribing to events. The payload of the events keeps the FHIR DB updated. The same needs to be done the other way when updates are received. Leveraging a consolidated organizational data store. While the ODS syncs with the transaction systems, it syncs the FHIR database along with it. Of course, depending on the frequency, the API call response may or may not convey the most current information. As and when organizations open themselves up for accepting data from outside, there would need to be some kind of an approval system to exercise control over what data gets merged with their own. Finally, there need to be monitoring and reporting capabilities to alert organizations of malicious requests, denied requests, or unserviceable requests. For provider organizations and possibly payer organizations in the future, there needs to be the technical infrastructure for issuing and handling notifications to interested parties. While for providers, it has already become a mandate in the form of e-notifications for patient events, payers might see this as a reality with intense payer-to-payer data exchange. Such event brokers would also need to have tracking, monitoring, and reporting capabilities as mentioned above. All this put together points to a significant endeavor to be undertaken by organizations, as they may have paths in place but not the workable whole of it. This is where we step in. We can help you plan the best approach for your organization to meet these compliance requirements and build the supporting technology. Get in touch with us for a free consultation.